Good evening and thank you for watching NTV wherever you are across Uganda. My name is Ben Mwine. By the time we are done in the next hour, 12 children will have lost their lives. By the time you go to sleep tonight, 282 children under the age of 5 will have lost their young and promising lives. More than 40% of those will be just about a month old or less. Another 15% of those will be just a day old. They have been born today or maybe sometime last night. Very scary statistic, very big problem. Save the Children has just released the 14th State of the Mother's World report, which details these and many other statistics and what we can do about this very big problem. Joining me to discuss this rather important issue of national importance in a very lively chat, which of course you can join us in later on, some very interesting people, many doctors in fact. You can call me Dr. Ben Mwine for the purposes of this hour by osmosis. I'll introduce our guests, starting with a person I have just discovered is the only Muchiga in Uganda who actually speaks fluent Luganda, Dr. Muwonge. Welcome to the show.
Thank you, Ben. Good evening, viewers.
He's got a lot of titles. He is the head of Samasha Medical Consulting. He's also the co-chair of Resource Mobilization and Awareness Working Group of the Reproductive Health Supplies Coalition. That's based in Brussels. But he's also a member of the UN Commission on Life-Saving Commodities of the Advocacy Working Group. A lot of titles. I hope they don't weigh you down. That's probably how you haven't put on so much weight. We're carrying so many titles with you.
I try to keep healthy.
Someone who's a regular guest of ours here at NTV, Dr. Jesca Nsungwa Sabiti, Assistant Commissioner of Child Health at the Ministry of Health. Welcome to the show.
Good evening, viewers.
And someone who needs very little introduction, very popular figure and face in our media, Honorable Dr. Sam Lyomoki, Workers MP, but also Chair of the Health Committee at Parliament. Welcome to the show.
Yeah, thank you very much, Ben, and good evening, viewers.
Thank you so much for joining us today to talk about something that, of course, is very, very important for us as a country. I'll start with you, Dr. Jesca, in terms of the stats that we're looking at. I mean, what I've just hinted on is just a tip of the iceberg. Worrying statistics in terms of how many kids are dying below the age of 5 and a month and a day old. Would you like to shed some light for us on how big the problem actually is for us?
Okay. Thank you very much, Ben. The situation in Uganda, and according to the report which has been released, shows that Uganda, we are still performing very poorly in terms of health indices, especially for mothers, newborns and children. And we've been ranked among the top 5 worst places to be born. And this report has actually identified that the biggest risk and the worst day for a child to live is the first day, to be on earth is the first day. This report does indicate that every day we lose about 16 mothers during the process of delivery or pregnancy. We also lose about 106 babies, and especially on the first day. For babies who are, many babies are not able to achieve their first birthday in this country, but has been shown that 40% of those babies who will not celebrate their first birthday will actually die in the first month. And that is very critical. And most of them will die on the first day or the first week. And therefore focusing the problem around the first day in this report. We also know that 90 out of 1,000 babies in this country won't celebrate their 5th birthday, which is a big problem. And we have set some targets in line with the Millennium Development Goals. And you can see, according to the trends and the target we are a long way to this target. We have to work very hard to get the target. We have less than 1,000 days to get to the 9-digit target of 2015. So you can see that the situation needs a lot of acceleration, needs a lot of focus, and needs a lot of support. And resources are one of our key problems in this area.
Let me bring in Dr. Muwonge at this point. Why do we have so many kids dying at such an early age? Where is this problem coming from?
Ben, I mean, the situation is not good in terms of a newborn health, but it starts from the mother. In Uganda, the total fertility rate is so high. We have one of the highest total fertility rates. Our women are so fertile. On top of that, we have a low contraceptive prevalence. There are many women out there who are saying we want to use contraceptives. They are not ready to have children, but they are ending up having children because of lack of contraception. And the statistics show that the unmet need for contraception amongst married women was 41, but now it has reached 35, but still very high. It's one of the highest in Uganda. On top of that, the contraceptive prevalence rate is around the 27, which is very low. So all these things, plus the nutritional status of our women, lead to the situation we are in. So a woman ends up having a child. Most of them are not ready to have children. Most of them have not planned to have children.
Plan to have them.
That's later on looking at the actual service delivery during the woman is giving birth. The other aspect is definitely the state of our healthcare system. When a woman delivers, we know that 42% of women deliver with unskilled attendants, and that contributes hugely to our newborn mortality.
And that's a very big number, isn't it? I mean, you think about 42% of mothers giving birth mostly at home. That's scary.
Yeah, it's scary. And also, the other issue is when the mothers who go to the health facilities to give delivery, there are also other issues that come up. We know that the budget for commodities has gone up. The government has allocated funds for reproductive health, so mama kits are being procured and delivering to the health facilities, but still the fertility rate of our women combined with the issue of healthcare system leads most of the problem that Dr. Jesca has talked about.
Let me bring in Dr. Lyomoki at this point. I mean, we will get a chance to put you on the spot and crucify you for these problems, because we expect you to be sorting these things out for us in Parliament. But first of all, from the stats that we're talking about, I mean, when you talk about them in terms of numbers, it sounds like, well, numbers. But in reality, you're talking about 130,000 kids that are dying every year. And the first question I think that comes to my mind, pointing in terms of towards the policymakers and legislators, is, are you aware about these figures and facts in Parliament? Do your colleagues know about how big a problem we have on our hands, Doctor?
Yes, I think in Parliament we are aware, and that's why I remember at the beginning of this financial year we refused to pass the budget because at that time we said we needed to recruit more midwives and more other health workers. But I would think that the policymakers and all of us, when we look at in terms of numbers, sometimes we don't even look at this as a very serious issue, because I would think that these are lives. Like for instance, if you talk about, as the doctor was saying, 106 children dying per day, that's actually one child almost per district, because we have 110 districts. You know, to see that every day we are losing a child in a district. You know, is it like if I want to really to paint this picture clearly to my colleagues in the Parliament, is it like within 3 days, because we are about 380 members of Parliament, within 3 days we are losing a whole Parliament. Younger people who between 20 and 30 years would be members of Parliament, and you know the whole of that house going.
We never think about it.
So I would think this is a very serious thing, and you know what makes matters worse is that the causes are known, and these are things that can be prevented. It is not that the doctors have failed. They don't. Maybe people are dying, and you know it is mysterious, and they don't know what is causing them. These are known. The causes are known. The strategies are also very clear. So I would think that Parliament is aware, and for many years, because I've been on the committee. Initially, we used to be called the Committee of Social Services, which was split, and then that's why we had to establish the Committee on Health, because Parliament was aware that health is important. We have come up with a lot of recommendations, trying to see how best we could improve. But I think the institution that I think we should blame, or maybe say they have not been insensitive, is the executive. Of course, I know that the executive and the Minister of Finance particularly have been trying to also to see how best to finance health and all that, with a lot of course, other challenges. But I would think that we have not looked at health as important. Most of the time when we try to push for an additional funding, and I can show you this, in 2005, that's when we had almost the highest funding in terms of proportion to the budget, and that was about 10%. But ever since that time, the funding has been going down.
The current budget, I think the proportion is about just above 7.
About 7.2. That we are going to be getting about 940 billion. But in terms of the whole budget, is about 7.2. And this financial ending, it was 7.6. The other financial, it was 8. So you can see the whole proportion has been going down. And yet, we committed ourselves as a country several years ago that we should move towards 15%. We would have thought that the time in 2005, when we reached that level of 10%, would have maybe gone to 12 or something like that. But to start going downwards, I think this shows really a lack of sensitivity and commitment from the side of the.
I wanted to ask Dr. Jesca about this in terms of how did we get to arrive at a figure of 15% of our budget going to health? If we did get to 15% of our budget going to health, would that actually solve the problem that we're talking about today?
Yeah, because I think essentially if the health budget increases, the assumption is that the proportionate amount going to maternal child health will also increase. And this was an agreement and a consensus for countries in Abuja who came together and they reached a minimum figure. Actually, this is just the minimum. The WHO recommends a higher figure, but this was a minimum among the leadership in the region. And for instance, if you look at the budget the Honorable has just mentioned now, if you tease it out, you'll find that even within that small proportion going to the health sector, only about 4%, for instance, goes to reproductive health. So you can see as long as the total sum is so little, when it gets to prioritization, again, these programs will suffer and the outcomes will be bad, as you have seen from the indicators.
For someone, Dr. Muwonge, who is not sitting or representing the government or the policymakers, someone who maybe has an objective point of view, do you think that the lack of resources is the biggest problem that we have in terms of tackling this problem? Is there something else that we can be able to do even with the few or meager resources that we have at the moment?
First of all, I'd like to say that we should not limit ourselves to the public sector. We have more than 2,300 public sector facilities, that's for government, and we have more than 900 private not-for-profit facilities, like in Zambia Hospital, Rubaga hospitals. Then we have more than 700 private hospitals, like Kampala International Hospital. So, in order for us to achieve this objective of reducing newborn death, we have to work together. The private sector, the public sector, the private not-for-profit, the NGOs, so they come together and really do something. And that's where the issues of the strategy, newborn strategy comes in. And so to me, that's one area that we need to look at as all of us, not only the government. The other aspect is advocacy. And we are very grateful that the members of parliament are very passionate about this field of work. We have very committed public servant, Dr. Jesca. And to me, I feel the foundation is there. The issue of financing, to me, goes also to how do we allocate the minimum, the little that we have. I'll give an example. For commodities, we know that for the newborn, the first 24 hours, they need actual supplies. They need to be resuscitated, they need chlorhexidine, they need to be warm. All those commodities should come from national medical stores. And right now, we have what we call a reproductive health budget. Last year, government committed 3.3 million, which was 7 billion. And this financial year, it's going to be more than 12 billion. The question is, how are we going to tap into that money to support the newborn? So to me, there are two issues.
And that's not a lot of money, is it? When you talk about, for the average Ugandan, 12 billion shillings is an astronomical sum of money. But in reality, when you think about the scope of what needs to be done, that's just pocket change, isn't it?
It's pocket change, but within that pocket change, how much are we getting for the newborn?
I think for me, I also look at the point of our mindset, because if you look at as the doctor has said, we have about 40% coming from out of pocket, people contributing. But up to now, the conception is that health is free. But we know that actually, out of all the money that goes into health expenditure in this country, 40% actually is coming from the people. But that fact is not known. If I have headache, then I go and buy aspirin or something like that. That's money which should be counted. But we don't. So I think for me, what we would do is, if we could come up with a consensus that health care is for all of us. Everyone is supposed to take charge. In terms, because there are many factors, as you have said, not only about money, but also in terms of how do people respond to issues of health, in terms of, for instance, taking children, for immunization. The other time in our committee, one of the biggest now problem we have is people coming, respond, because we said, when you look at the money and all that, there's a lot of money in terms of, allowances and whatever, because, people are trying to go on the ground, trying to advertise. People are not, until people are told by the health workers, and, you go there and so then they will come for immunization, but they will not themselves look for immunization. As a demand, it will be demand.
So that's already something.
They will not even, they will not even, the women will not even have the demand that I must go and look for skilled health work. Or the committee, we were in Rwanda, we have done a lot of benchmarking as a committee. We went to Sri Lanka, went to all these countries. People countries which we think are also poor, but which are doing very well. Now, one of the discoveries, for instance, we found in the other place, in one of our neighboring countries, was that in terms of health, everyone is aware. In fact, if you have fever or headache and you start sleeping, your neighbor will come, no, why haven't you gone to hospital? Because it is known that if, for instance, a mother dies because of when she's producing or something, the LOC1, the equivalent, will be arrested. Everyone will be responsible, even the husband will sleep in the cell that, and you have to explain until finally they know who is the responsible person. So even immediately they see I'm having headache and you have locked yourself in the, everyone will be saying, but have you gone to the...
It becomes a collective responsibility.
More than 700 private hospitals like Kampala International Hospital. So in order for us to achieve this objective of reducing newborn death, we have to work together. The private sector, the public sector, the private not-for-profit, the NGOs, so they come together and really do something. And that's where the issues of the strategy, newborn strategy comes in. And so to me, that's one area that we need to look at as all of us, not only the government. The other aspect is advocacy. And we are very grateful that the members of parliament are very passionate about this field of work. We have very committed public servant, Dr. Jesca. And to me, I feel the foundation is there. The issue of financing, to me, goes also to how do we allocate the minimum, the little that we have. I'll give an example. For commodities, we know that for the newborn, the first 24 hours, they need actual supplies. They need to be resuscitated, they need chlorhexidine, they need to be warm. All those commodities should come from national medical stores. And right now we have what we call a reproductive health budget. Last year government committed 3.3 million, which was 7 billion. And this financial year it's going to be more than 12 billion. The question is, how are we going to tap into that money to support the newborn? So to me, there are two issues. And
that's not a lot of money, is it? When you talk about, for the average Ugandan, 12 billion shillings is an astronomical sum of money. But in reality, when you think about the scope of what needs to be done, that's just pocket change, isn't it?
It's pocket change, but within that pocket change, how much are we getting for the newborn?
I think for me, I also look at the point of our mindset. Because if you look at as the doctor has said, we have about 40% coming from out of pocket, people contributing. But up to now, the conception is that health is free. But we know that actually, out of all the money that goes into health expenditure in this country, 40% actually is coming from the people. But that fact is not known. If I have headache, then I go and buy aspirin or something like that. That's money which should be counted. But we don't. So I think for me, what we would do is, if we could come up with a consensus that health care is for all of us. Everyone is supposed to take charge. In terms, because there are many factors, as you have said, not only about money, but also in terms of how do people respond to issues of health. In terms of, for instance, taking children, for immunization. The other time in our committee, one of the biggest now problem we have is people coming, respond, because we said, when you look at the money and all that, there's a lot of money in terms of allowances and whatever, because people are trying to go on the ground, trying to advertise. People are not, until people are told by the health workers, and you go there and so then they will come for immunization, but they will not themselves look for immunization. As a demand, it will be demand.
So that's already something.
They will not even, they will not even, the women will not even have the demand that I must go and look for skilled health work. Or the committee, we were in Rwanda, we have done a lot of benchmarking as a committee. We went to Sri Lanka, went to all these countries. You know, people countries which we think are also poor, but which are doing very well. Now, one of the discoveries, for instance, we saw in the other place, in one of our neighboring countries, was that in terms of health, everyone is aware. In fact, if you have fever or headache and you start sleeping, you are